Hi, I'm Dr. Alicia Burlaz, and I'm here to comment on a study that was in the Journal of Internal Medicine in September's edition. And this study suggested that the veterans returning from Iraq and Afghanistan with mental health issues such as PTSD are also more likely to experience medical concerns. The study's lead researcher, Dr. Susan Frey, out of the VA of Palo Alto, California, and Stanford University, also pointed out that this effect is more common in the female veterans. Well, this brings up a couple of interesting issues. First, why would this be more common in female veterans? And second, why would this be happening at all, that PTSD would lead to greater medical issues? Well, looking at the first question, why is PTSD more common in female veterans? One thing we know is that those who experienced childhood traumas or other traumas earlier in life are more likely to experience PTSD when in a combat situation. Unfortunately, women are more likely to experience physical traumas, particularly sexual traumas, earlier in life. In fact, besides sexual abuse, 1 in 3 females in this country experience sexual assault. Given those statistics, it's not surprising that female veterans would then be more likely to have PTSD. And that brings us to our second issue, that of PTSD and medical problems. And why would that occur? Well, one of the hallmark features of PTSD is that someone is hypervigilant. They're constantly on edge, looking out for what might be happening in their environment. This hypervigilance increases stress hormones such as cortisol. One thing we know is that when cortisol is increased, our immune system is decreased. So this makes us more prone to infections, but it also affects another system, and that's the inflammatory system. We need cortisol to raise at certain times in order to keep inflammation under control. When cortisol is always raised, the inflammation can get out of control, and then we're more likely to experience inflammatory diseases. And we're actually finding out that a lot of diseases have an inflammatory basis, not just things like hypertension, where the vessels become inflamed, but even such things as depression, where those inflammatory agents go into the brain and can cause a lot of our depressive symptoms. In addition, having that much inflammation causes joint pain as well as lower back pain, which is 2 of the things that this article pointed out. So I hope that helps in understanding why we might be seeing this phenomenon more and more, and how we can also help our clients by treating PTSD and then, of course, hopefully mitigating some of the medical issues that might arise. Thank you.